So now you have all of this information. What do you do with it? That's part 2, nursing diagnosis. And this is where your assessment becomes the action you take. The first thing that I need to clear up that every nursing student really gets confused on is that a medical diagnosis is not a nursing diagnosis. Your doctor diagnoses pneumonia. That's a medical diagnosis. It describes the disease process. You, as the nurse, diagnose impaired gas exchange related to the pneumonia as evidenced by, and then you include your assessment findings. Do you see the difference? The medical diagnosis tells you what is happening physiologically. The nursing diagnosis tells us what problem your patient has that fits within the scope of what you're able to provide them. Now, as I previously mentioned with the pneumonia example, every nursing diagnosis has 3 parts. This is the NANDA format, and you've heard about this in nursing school, so let's break it down. Part 1 is the problem. What is the diagnosis itself? This comes from the NANDA list. Some examples are impaired gas exchange, acute pain, risk for falls, ineffective airway, fluid volume excess. Part 2 is related to. This is where the medical diagnosis comes in. This is the etiology. This is the root cause. So if you have acute pain, it's related to a surgical incision. If you have decreased cardiac output, it's related to a hypertensive crisis. The root cause is part 2 or related to. 3 is as evidenced by. This is where all your assessment findings exist. What data that you collected at the very beginning supports the diagnosis that you're talking about. Now, your subjective and objective data can live here. So a full nursing diagnosis can look like impaired gas exchange related to pneumonia as evidenced by O2 sat of 82%, respiratory rate of 24, patient reporting dyspnea at rest. It tells everyone reading the chart what the problem is, why it exists, and how you know. Now let's back up a little bit and talk about NANDA. NANDA is the North American Nursing Diagnosis Association, and this is the standardized list of all the approved nursing diagnoses that you can pull from. Now this is how I use it practically. This is what I did in nursing school. Hopefully this can work for you. Now I do my assessment. I pull out the things that the patient is experiencing that maybe I can help with. Then I go to NANDA and I find a diagnosis that best matches what I think I could help with. Now, the ones that you'll see consistently in clinicals and fundamentals: acute pain, impaired gas exchange, fall risk, fluid volume excess or fluid volume deficit, impaired skin integrity, impaired mobility, decreased cardiac output. Know these, and the rest you can kind of look up. You don't have to remember the entire list. Now, here is the mistake that I see most of my nursing students making in fundamentals. Students will write nursing diagnoses that don't actually match to the data and the assessment that they did. They will assess the patient, they will collect all this great data, and then they pick a nursing diagnosis that does not best identify the data that they have. Or they pick a diagnosis that is very real, but they don't have the data that they need to back up that diagnosis. So I want you to remember that your nursing diagnosis has to be directly supported by the data and the assessment that you made. If you don't have evidence for the nursing diagnoses that you have to go back and reassess. That kind of explains that 3-part series. You want to go ahead and do your assessment, take in all the data you can, go through what you think you can actually help with. Explain what it is you're actually helping with, right? You're helping with impaired gas exchange. You're helping with acute pain. You're helping with impaired mobility. You're helping with anxiety. How do you know that that's what that is? That's where you go with your as evidenced by. That's it. That's part 2 of ADPIE series. Next part will be part 3, and it will be planning. And that's where you take your nursing diagnosis and you actually create a goal for your patient. Subscribe if you haven't already. And if this helped, save it, share it, and come back for more. If you have any questions, leave your comments down below, and I hope to see you next time.